briefing with Mayor John Cooper and Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force and Chair of the Metropolitan Board of Health. We will also be joined today by DaCosta Jenkins, President and CEO of NES, and U.S. Congressman Jim Cooper. Also here to help answer your questions will be Director and Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Health of the Metro Public Health Department. We'll begin with Mayor Cooper.
Good morning. Nashville, this week our case numbers surpassed the July peak. Our 14-day average case count is now 390, and our 7-day average of new cases per 100,000 residents is now 58. This is almost 5 times higher than it was in September. And there are now more COVID patients in our hospitals than at any point this year. In Nashville, there are currently 362 COVID-19 patients in hospital. That's more than a 50% increase since November the 1st. From the beginning, flattening the curve has been about preserving hospital capacity. And this fall, Dr. Fauci and our own Dr. Hildreth warned that unless we lowered case counts further, a winter spike could be especially dangerous. And this is what we are seeing. Experts expected the rising trend in hospitalizations to continue. Based on transmission rate and case trends, the number of people hospitalized with COVID-19 will likely increase, at least by another 10% in the next week alone. Nashville, this is the curve we must flatten. In the spring, hospitals felt that 1,000 hospitalized COVID patients statewide could strain our health system's capacity. And today, our state's hospitals are handling almost twice that number. Now, there's a limit to what even they can do, and hospitals across the region are nearing their exhaustion point from a staffing perspective. Now, 1/3 of COVID patients in Nashville hospitals are from other counties, which speaks to the need for a regional and statewide approach. Our local healthcare system is vulnerable to our region's response. A state mask mandate has never been more important to protect healthcare capacity. Sensible restrictions on gathering size are also important. Now, we need a unified response. This is not a one-county problem. This week's White House Task Force report warned Tennessee to expect a deeper and unyielding spread of COVID across the state. The report noted a nationwide correlation between Halloween activities and increased hospitalizations and deaths. And with Thanksgiving a week away, we could be on the verge of an additional potential super spreader event if we are not careful. Now, public health continues to recommend against visiting at-risk relatives and urges that people isolate and get tested before gathering for Thanksgiving. Please reconsider any plans to gather with those outside of your household. Every public health expert has recommended 2 things. 1, masks, and masks everywhere in our region with a high compliance rate. And 2, reduce the size of grouping or clusters and prevent any close contact between those clusters. Now, particularly during this holiday week, when we will be in contact with loved ones, we must do it safely. Effective Monday, November 23rd, our public health order will be modified to do our part in helping slow the spread. The limit on grouping or gathering size will be adjusted to a max of 8 people, down from 25. This rule of 8 aligns with the 8-person maximum dining party restriction already in place at restaurants. But whether in a public or private setting, restricting social contacts is critical to curbing the spread of the virus. This virus spreads in all settings. Let's limit groupings to 8, or to just add 1 other family group. Now, Sweden, which is globally noted for being less stringent in its early policy response to the pandemic, Sweden is now limiting gatherings to 8 people, and yesterday, Kentucky announced a rule of 8 as well. The rule of 8 needs to be our guide as we enter the holiday season. It should prompt everyone to think with caution when inviting friends over for dinner or going to a baby shower or hosting a game night. It's critical we limit our social contacts to 8 or to one other household at most. The rule of 8 acts as that reminder, and I hope that other counties will join us in adopting the rule of 8 to prevent clustering. This will limit the chance of super spreading. All public health authorities have strongly urged grouping limitations. Now, consistent with the need to reduce in-person gatherings and in consultation with the leadership of Metro Nashville Public Schools, all indoor extracurricular activity will be paused until further notice. And additionally, public health will apply a stricter filter to any new event application requests over the next 2 weeks, one life cycle of the virus, beginning on Monday. With the virus surging, now is simply not the time for large social events that could lead to any contact between clusters. So we each have a mission in flattening the curve. If you must absolutely get together with people outside your household, limit your gathering to 8 people. Don't drop your guard just because you're around people that you know. Maintain social distancing and wear your mask when you're with people outside your household. Please get tested if you've been exposed or have symptoms. And if you're feeling sick, isolate at home. Masks and restrictions on clustering are the best tools we have until we have a vaccine. We must recommit ourselves to staying safe and preserving our hospital capacity. And as a reminder, if you get a call or a text from the health department, please cooperate and answer questions so they can effectively trace cases and help stop the spread. Now, I'm pleased today to welcome DeCosta Jenkins, President and CEO of Nashville Electric Service. DeCosta will share an update about the resources available to help NES customers with past due electric bills. If you need assistance, you can visit needlink.org, www.needlink.org. And also joining us today is my favorite Congressman, Jim Cooper, who is joining us from Washington. Normally, our families would join each other for Thanksgiving, but this year we will not, as we remember to keep groupings limited to 8. Jim will give us an update on the federal outlook as it pertains to additional COVID relief funding. And I'm hopeful that the incoming Congress can come together to pass the Save Our Stages Act and another round of federal support for businesses affected by the pandemic. And now it is time to recognize Nashville's Community Hero of the Week, Leslie Homra. Leslie is a retired nurse and Vanderbilt alumni who's been serving the Hillwood High School food distribution program since March, when the program began. She brings her own pickup truck each week to help deliver food to nearby apartments and goes the extra mile on Thursdays by also delivering food to over 20 Hillwood students. Her positive attitude has been essential in the success of this program. Leslie represents the best of Nashville in this most trying of years. And now I'd like to turn it over to Dr. Alex Shahanger, Chair of the Metro Nashville Coronavirus Task Force. Alex?
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus. The number of active cases currently is 3,799. Last week, we were at 3,139, and our peak was 5,838 back in July. This brings, today we're announcing 471 cases, which brings our total number of cases to 42,004 patients. Our rolling 14-day average of new cases is 390, up from 345 just last week. And our 7-day average of new cases per 100,000 is at 58, up from 50 just last week. 7-day positivity continues to go up at 9.8%, again, up from 8.7 the week before. This comes to the fact that just last week, Nashville tested the most amount of people ever at 41,005 individuals. This brings the total number of tests that we've conducted in Nashville to over 606,000. Now, 350 Nashvillians have died from this virus. And while some people have told me, well, this mortality rate is 0.86%, I would like to highlight again that if you're over 75, your probability of dying is over 12, if not 15%. The transmission rate is 1.25, the highest it has been since June 29th. Last week, we were at 1.15. Again, as a reminder, transmission rate gives you a sense of how quickly this virus is spreading and how many people one individual that is infected gives the virus to. With all that said, the disease activity in Davidson County per 100,000 makes us the 39th worst county in our state. 39th. And so I think this highlights the significance of this problem across our entire state and our region. Middle Tennessee hospital capacity today is at 13% and Davidson County at 8%. And ICU capacity in Middle Tennessee is 9% and Davidson County is at 8%. Now, as the mayor announced, we're going to limit the size of gatherings to 8, and the public health will have a stricter filter on new events applications. Now, because as the cases continue to rise, we are seeing more and more strain on our hospitals. Now, the mayor and I are in regular communications with our hospital systems across the region, and here's what they're saying. They're saying the hospital capacity is tight, and it's tight because staffing is tight. The reason there's not as much staff available is because the staff at local hospitals are also getting infected, and they have to isolate and take care of themselves. But here's the kicker. They're not getting infected in the hospitals. In fact, hospitals, for the most part, are fairly safe. They're getting infected in the community, whether they're out in gatherings. And actually, a lot of these stories I've heard are people who, a group of coworkers go out for a gathering or a baby shower. People are getting infected because of the high community spread. Now, today, there are 607 individuals in our Middle Tennessee hospitals with COVID-19. 180 of those individuals are in vents. And as the mayor noted, 362 of those individuals are right here in Nashville. And 126 of those individuals are in ICUs. Now, we got to do our part, guys. Stay at home, work remotely if you can, limit your trips out. And if you have to go out, wear your mask and keep your distance. Thanksgiving is a week away. Now, I know we're all looking forward to this holiday, and honestly, after the year we've had, I mean, the holiday season is more exciting for me than ever before. But you got to be cautious as you're moving forward, and I know I will be. My family, we're trying to limit how much indoor gatherings are doing to keep the virus from spreading, because those that it spreads to may be the medically vulnerable. We're not going to have a big family dinner just like the mayor with our extended family this year. And I'm asking all of you to please take the precautions needed to do the same. Now, a couple of reminders. Our assessment centers are open today and tomorrow from 8 until 2. In addition, today, the Antioch assessment site is providing COVID tests as well as giving flu shots. You can drive up and get your flu shot, and it's free, even if you don't want to get a COVID test. And this is part of a bigger statewide initiative to give flu shots today. And so if you want to go to our assessment site, you can in Antioch, or if you want to go to any of our 3 public health clinics at Lentz, East Public Health, or Woodbine, anytime from 10 a.m. to 6 p.m. today, you can get your free flu shot. And I can't emphasize the importance of a flu shot this year more than any. Also, by us being able to trial a drive-through flu shot at the Antioch site, this actually is a great opportunity for us to test the feasibility of a drive-through vaccination plan. Our public health team is currently working with the state on plans to administer the COVID vaccine once it becomes available. And trial runs such as the one we're doing today with the flu shot at our Antioch site is critical to making sure that our community gets access to the COVID vaccine as soon as it makes sense. And finally, as a reminder, next Thursday and Friday, our community assessment sites will be closed. However, we are increasing the hours of operation next Monday, Tuesday, and Wednesday from 7 a.m. to 3 p.m. to give people increased access to testing. Furthermore, 1 week after Thanksgiving, on December 7th through the 9th, we are increasing the hours of our sites also from 7 a.m. to 3 p.m. in case there will be an increased demand for tests. Nashville, thanks for all you do. I hope everyone has a wonderful Thanksgiving holiday, and please be safe.
All right, both DeCosta Jenkins and Congressman Cooper will be joining us by WebEx. We'll hear first from DeCosta Jenkins.
Good morning. We want to thank the mayor's office and the Metro COVID-19 task force for their tireless efforts in regard to our health and safety. At NES, we understand the hardship our customers are going through during this time, and NES wants to help. The last thing we want is for someone to have their power disconnected. Many customers have fallen behind on their power bills. We want them to catch up. There are millions of dollars available and multiple ways for customers to get assistance in paying their power bills if you have to apply. To help you navigate through all of the available options, we launched the website, neshelp.com. We urge customers to go to neshelp.com today. NES received a $16 million rate reduction credit from the Tennessee Valley Authority, and we're giving every dollar back to our customers. $10 million will be evenly distributed to every residential customer on a monthly basis as a COVID-19 relief credit for the next year. $6 million in funding is available for customers struggling to pay their bills who need link, up to $650 per eligible customer. Additionally, there are millions of dollars of assistance offered to other organizations like Metro Cares, Metro Action Commission, Mid-Cumberland Community Action Agency, and more. I know this is a lot of information to take in, and that's why we created the website, neshelp.com, where you can find all the assistance options. We want NES customers to know that help is available. Thank you and happy holidays.
Thank you, Mr. Jenkins. Now we'll hear from Congressman Jim Cooper.
Good morning. I'm speaking to you today from your office in Washington, D.C. I hope when COVID is over, you can all come visit. Right now, though, as my favorite mayor, John Cooper, said, not only have we canceled Thanksgiving plans, we just canceled my grandson's first birthday, which I was very much looking forward to. But due to the COVID, you just can't have even small gatherings like that. So we're working hard to try to get our nation back on its feet. We need more COVID relief funding from Washington. And I'm afraid I've got bad news to report to you on that. Our friends in the U.S. Senate just suddenly adjourned last night. They went home for the Thanksgiving holidays, so now there's no chance at all of anything passing until Congress resumes again in the early weeks of December. And it could well be until January and after the inauguration, January 20th, before Congress takes real action. So I'm sorry to tell you that because I had hoped that we would remember the history of this is tourist-based, healthcare-based economy. And we've really been hammered with empty hotels, empty restaurants, and our music venues have also been hit hard. So in the extra relief package that actually the House of Representatives that I'm part of, we passed back in May, and then we repeated the passage of the bill in September. But our friends in the Senate did nothing. Mitch McConnell from Kentucky just sat on his hands for months and months and months, and he even suggested that some states should go bankrupt. So right now we're at an impasse. We need at least $2.2 trillion worth of relief. Right now, the White House on occasion has been willing to go up to $1.8 trillion. But now with the uncertainty of the election, Secretary Mnuchin hasn't really even been in the country most of the time to conduct negotiations. So now with the Senate adjourned, we're really in a stalemate position. The numbers for Nashville are these, and I know that no amount of aid is enough, but the Metro government itself has received about $260 million from COVID relief from the CARES Act. So that's a lot of money. I wish it could be more because the hole that we're trying to fill is huge. But there's better news for Nashville as a whole and for the 5th Congressional District. We have received in our community something like $3.7 billion, billion with a B. Now, a lot of that money has been with the direct stimulus checks. That's some $600 million. That's the $1,200 per person checks that were handed out. A lot of that money has been in the form of enhanced unemployment insurance. The unemployment benefits in Tennessee are about the lowest in the nation. So the federal government really beefed those up with a $600 per week add-on that was indispensable. We also extended the period for unemployment relief, and we added a special category for songwriters, gig workers, independent contractors, folks like that, which previously really hadn't been covered by the Tennessee unemployment system. But a super important category, a huge category financially, is the $1.2 billion that have been handed out to Nashville area businesses in the form of PPP loans and so-called EIDL loans from the Small Business Administration. That's a huge amount of money. Most of that money was handed out by commercial banks, but it's a federal program. And those loans were at very favorable 1% interest rates. And if you meet the conditions, then those loans automatically turn into grants, which is even more favorable. So the bottom line is this: my job is to help Nashville and Nashville citizens get as much money, as much relief as possible from the federal government, and to do that as soon as possible. We already passed the largest aid relief bill in U.S. history, and that should have been followed up with an even larger package. But our friends in the Senate have stopped us from doing that. We also are working hard to make sure that particular industries are covered. I worked hard to make sure that the Save Our Stages Act for independent music venues was covered in the House passed bill in September. We've worked hard to make sure that our restaurants are covered, because so many of those businesses are the first closed, the last reopened, and the hardest hit during this COVID pandemic. You know, live music is a vital part of Nashville. We wouldn't be Music City without it. And so many of our restaurants and other entertainment venues depend on that as well. We've got to keep our musical community strong during this pandemic. And it's sad for Nashville, but as a tourist-based economy, we've been among the hardest hit places in the country. So that's a report from Washington. That's from your office in Washington, D.C. I can't wait to be back home and celebrate the holidays, but I'll largely be doing it just with my own household because of the pandemic conditions. But I'm proud of the mayor's great leadership, and I'm proud of the city of Nashville being a beacon of hope for the entire state, for the entire region. So thank you for letting me participate in this call, and I look forward to any questions that there might be.
Thank you, Congressman Cooper. We'll now begin taking questions from media, starting with Brett Kelman at the Tennessean.
Good morning, everyone. I have two primary questions today, both for Mayor Cooper. First, I'm sure everyone's aware that Metro schools have telegraphed a strong likelihood they will go back to full virtual instruction after the Thanksgiving holiday. How does the gathering cap of 8 impact families who want to use education pods to continue to gather kids at their homes to do virtual learning? Second, I know that the latest White House recommendation report suggested capping indoor dining at restaurants at 25% as something that was necessary across all of Tennessee. Why are we not doing that?
Well, thank you, Brett, for those two thoughtful questions. The first question on ed pods, I would love to consult with the school system and see what they think and what is the reality of ed pods and how inconsistent is that with 8. So much of this is about cross-clustering spread, accepting the risk profile of your family who you already exposed to and not adding to that. So I expect if there's a pre-existing pod and it's relatively limited and you're not adding to that, then I imagine the guidance would be to gently allow it, but not to go out and add pods or cross pod. The health guidance very much, and it's important for, I think, all of us to help enforce it and to try to live up to it, is limit your cluster and then don't go between clusters. Understand that within your cluster, you're exposing people already, they are exposed. So you're not adding, don't add additional risk is another way of thinking about it. Now, in terms of the White House report, a lot of that White House report, I do think, is not written with Davidson County in mind. where we've had masks and we've had restrictions and we have had limitations already in place. So I think it's up to us to accept the spirit in which it's written, which is to get on this problem and do what you can. But I don't think the White House report is necessarily calling out Nashville, because we really have been a leader in the region with restrictions that we have implemented. And then with contact tracing, we're always trying to make it better and to go back and understand what is actually effective. And today's message is not only to masks are important. That's our number one tool. You have to have a regional mask compliance rate that is very high, but also understand the risk profile that you and your loved ones have and limit that risk profile. Don't add to your grouping size, and then don't go between groupings necessarily. And I think that's very much in spirit of the White House report, which again is asking a country that has so many different standards in so many different places, so many different guidance, to cut through that with a general message of do better.
Our next question is from Blake Farmer, WPLN. Blake?
Yeah, and thanks for taking the question. I guess I wanted a few more details about this restriction of 8 people. How will this affect gatherings that have already been approved by the health department that are fairly regular? I'm thinking of the Grand Ole Opry hosting concerts that I think have hundreds of folks. Certainly, I think there are still a couple of Titans games that would be at home. How can you sort of justify allowing those if you're telling folks, don't even have more than 2 households together?
Well, thank you, Blake. I'll go first, and then no school system in America is happy about where we are. Whether you're open or you're closed or you're in a hybrid or you're in a digital model, this exposes a vulnerability. The pandemic exposes a vulnerability in education. Now, we in Metro, I think, should be pleased with every kid having a laptop and us doing 10 years of digital work in the matter of a few months to establish at least a path for going forward. Is anybody happy about this? No. And of course, it's with the vaccine that we are depending before we can really get back to normal and we can really expect normal performance out of our ed system. But in this period of crisis, we are all navigating it, listening to every set of parents and every set of staff members. And let's just value our teachers, think what they have been going through in doing this. This is not easy too. And nothing hurts all of us as much as this idea of kids falling through the cracks, right? That's alarming. And of course, every school system in Nashville, public, charter, parochial, and private, are deeply concerned about the same things. And they're all having kids falling through the cracks, I feel, frankly. And it's one of the things that whoever, gets the Nobel Prize for this vaccine, I hope gets an award from Nashville too, because we need it that badly. Thank you.
Our next question comes from Kathleen Seary from Channel 17. Good morning, Kathleen.
Good morning. Thanks so much for taking our questions. I have two this morning. So the first is for Dr. Jahangir and possibly Mayor Cooper, if he'd also like to weigh in. So this weekend, the House Republican Caucus is hosting a retreat in Hardin County, which could potentially be bringing dozens of lawmakers from all over the state together. We just heard from Mayor Cooper about how now is not the time for large social gatherings or meeting with people outside of your normal contact, but there will most likely be far more than 8 people at this event and contact with people outside of their normal routine. I was wondering if you guys could weigh in on this and give perspective on if this could potentially be a spreading event. And then the second question is for anyone with the health department, just for a little more clarification on how the health department is going to be more strict on what they approve for events, given the rule of 8 that you just announced. Thank you.
Well, Kathleen, if you don't mind, let me jump in first. I appreciate your question, and the inconsistencies in government is always something that people should be aware of in public. I do want to point out an interesting factor. Our own city council has been meeting in what would appear to be a larger group, but I think it's done it very safely. And so the ability to have a gathering, which is larger than 8 and still be safe, is possible. Now, I don't know what goes on behind closed doors, and nobody does. So we are not able to examine it, but theoretically, there is the possibility to bring a group of people together and not have cross between clusters. And that requires social distancing within the meeting itself. And again, I know this is something that the Metro Council has worked extremely hard on and has been successful with doing that. But the conduct of those meetings, it's not a normal conduct. It's social distancing, it's approaching the microphone, it's wearing masks, if you're willing to abide by all the rules, you can be safe, it would appear. But we have to be constantly concerned, again, about spreading beyond the cluster and breaking down in our habits, our good, safe habits. Thank you, Kathleen.
Good morning. We look at certain criteria to evaluate each of the applications that are submitted. And I'd like to remind everybody that if you go to our covid19.nashville.gov website, if you scroll halfway down, there's a button for event worksheet and application form. If you click that on, you'll see a series of questions that we ask to help those who are filling out the application, as well as our staff that are reviewing it, to look at certain criteria. And those criteria are whether it's an outdoor event or an indoor event, whether masks will be worn at all times. And one of the clues to that would be, are you allowing eating or drinking. If you're not allowing eating and drinking and it's just an event, we're more secure that masks will likely be on at all times. Is there appropriate social distancing and monitoring and enforcement of all masks and social distancing? Will alcohol be served or not? How many people will be at the event? And what is the length of the gathering? Is it just an hour or is it all day? So each of these criteria we will be looking at and being more thoughtful to reduce some of the risks that we see when we do approve these. Thank you.
Thank you, Dr. Caldwell. Our next question comes from Nancy Amons from Channel 4. Nancy, good morning.
Good morning, Brian. As you know, I often have several questions, and today is no exception. One of the questions is, what is the test turnaround time now? Is it getting longer? The next question is a follow-up what several reporters have already asked about the limit of 8 and how you're going to apply it to things that have already been approved, like weddings. You're not going to go back and retroactively say no or disapprove anything. Also, can you give an idea of how many events have been turned down because you didn't like the guidelines? And for Congressman Cooper, I'd like to say congratulations on your re-election. It was certainly a tough fight. Can he speak to what's the mood in DC about not exactly knowing who the next president is?
Would you like to go first?
You want?
We can go to.
Okay, you want me to go first? Nancy, thank you. Sorry. The test turnaround on average now, I hear it's delayed some, so it's about 4 or 5 days now. I know the city sites, and this is across all sites in coming to Nashville. And the issue is there's a national reagent issue. Again, I know the lab that we work with here in Nashville is working to correct that, and they're really working to speed up the turnaround. That was question one. Question two around, Dr. Caldwell, do you want to answer? Okay, I think question two is about how many events have been canceled. Dr. Caldwell informs me of 0 have been canceled. Do you want to? Yeah, and I'll let Dr. Caldwell actually take this question. I apologize. Thank you, Nancy.
Thank you, Dr. Jahangir, and good morning, Nancy. Yeah, of the events that are already approved, we are certainly going to be reaching out to them and making sure that they know we want them to be extra cautious as always. But there have been 0 events that have been submitted that haven't been approved. We've approved every event that's been submitted. And the good news is we've been able to modify those events and make them safer events. Moving forward, we definitely are going to be more strict in our criteria, but it's going to be on a case-by-case basis. So we can still have these events with these guidelines and be more strict.
Thank you, Dr. Caldwell. Now we'll hear from Congressman Cooper.
Thank you, Nancy. The mood in Washington is actually very optimistic. The Electoral College will meet in December 14th, and it looks like, even according to Fox News and the Wall Street Journal, that Joe Biden has a substantial lead. So remember, the election was not so great for President Trump, but it was great for Republicans in the Senate and the House. And it's the same ballots, same election systems that were used for both. So it's very hard for the president to question the integrity of the election when his fellow Republicans actually did very well in all the elections down the ballot. So I think as you see states certify their results, and Georgia is completing their hand to recount today, I think you will see very few, if any, of the real results change. So I wish the president would make some public appearances, be more forthcoming. For a man who'd been so visible during his 4 years in office, to suddenly disappear on us for a week or 2 now, it's been very odd indeed. He's planning some big press conference today, midday, and so perhaps he'll pull a rabbit out of the hat then. But his appearance by his own lawyer, Rudy Giuliani in Pennsylvania, was something of an embarrassment. So I'm hopeful we can resolve this because the Biden team needs to have a smooth transition. We need a peaceful transfer of power. And even according to Republican election officials in all the states, the elections were actually conducted very well.
Thank you, Congressman Cooper. Our last question comes from Harriet Wallace at Fox 17. Harriet?
Well, good morning, everyone. I've got a few questions. The first is for Mayor Cooper. Mayor Cooper, I talked with the county mayor, Murray County Mayor Ogle yesterday. He mentioned that he has continued to not want to or feel the compunction to institute a mask mandate because he says he does not have the legislative power to, and that if the General Assembly were to make that call, then he would. So as one who has said we need mask mandates in our surrounding counties, have you made any steps, or has your office made any steps to work with our state lawmakers and, you know, discussing this initiative that could move some of our neighboring mayors who have not instituted a mask mandate? My second question is, as we talk about the rule of 8, how exactly is this going to be enforced? I just sense that we have a lot of questions, and there's going to be some confusion because there are a number of events and gatherings versus groupings to consider. How does everyone define that? But how exactly is that going to be enforced if it sounds like this mostly applies to private, but then maybe some public? And do we have staff and capacity to enforce and police the entire Metro Davidson area? My last question, also, this is in regard to the announcement of the retirement of Captain Reinbold yesterday. He is in the middle of an investigation regarding sexual harassment. In my understanding, TBI is taking this investigation on, which is not yet complete, but yet he has retired, which means that he's now leaving with full benefits. Mayor Cooper, as one who has put together a policing commission and who is about to hire our next chief, can you please share your thoughts about this, the message that it sends to the community about policing culture? Someone in the middle of an investigation so serious is retiring with full city benefits. Thank you so much.
Well, thank you, Harriet, very much. And I'll get to all three questions. Dr. Shahanger, Dr. Caldwell, I think would also like to talk a little bit about enforcement because it's going to be a real question. The first question on the Murray County mayor is the reality is so many of our other regional counties do have mask orders. So clearly it can be done. If you talk to the health executives of our regional healthcare facilities, including in Murray County, they feel strongly that it must be done. I don't really think that if there was a county order that the state would dishonor it. You know, I mean, this is, I think, one of the principles of the state has been local government, local management, have local mayors decide what is good for the counties. We wish that was a little bit broader, but no mayor under this environment can escape responsibility for mask mandate in their own county, to be sure. I think it would be easier if it was from the state and you would have deeper compliance, which begins to get to the role of enforcement and going forward. Why are we talking about here the rule of 8? I mean, we each have a mission to get this done, every citizen, every family member. And on enforcement, I think we should be clear. Don't think it's up to somebody else to do this. Don't think that it's up to a cop or a nurse or to somebody else to do what we know is right. It's up to you. That's both in public space and that's in private space. That is all the time. We share air with family members. And so that's an expected risk that's there. Our message today is limited to that group, limit to the people who are already exposed and at risk. And every day it's up to all of us to get that further. And it's a personal responsibility. Now, it is helpful to have everybody, every county, every government employee to be out there and reminding people, every teacher, every nurse, all of us are responsible people to go and do that, and not to get into a system of people trying to avoid responsibility, which is what we all worry about, that at any county layer, you kind of lawyer the matter into saying, oh, I'm somehow not responsible. Well, we are all responsible and we can all do it. And then on the final question is, if there's an investigation going on, I expect it to continue. And we're going to get to the bottom of this. The truth will out, and it's not going to be suspended because somebody somehow seemingly elected not to participate. That's not going to be the case. And I have every confidence that our chief will pursue every investigation to wherever it leads. Thank you.
Thank you, Mayor Cooper, and to amplify some of your remarks. Certainly, we need everybody's cooperation. We can't be everywhere all the time, and we do not intend to be everywhere all the time. It takes all of us. We're providing guidelines. We're providing guidance. We need your help. We all need to contribute together to wear our face mask, to socially distance, and follow these guidelines as best as we can. We have to be serious and be vigilant. We will respond to complaints and we will continue to provide guidance, but we need everyone's help.
Thank you. Those are all the questions we had this morning. I'd like to thank DaCosta Jenkins and Congressman Jim Cooper for joining us today. As always, we're grateful to Amy Lankheit and our partners at the Bridges for the Deaf and Hard of Hearing for providing the ASL translations for these briefings. There will not be a Metro COVID press briefing next Thursday due to the Thanksgiving holiday. So the next press briefing will air on Thursday, December 3rd at 9:30 a.m. Thank you for joining us, and this concludes today's briefing.